tell me, you had lots of back pain, you had lots of leg pain. Tell me about it. How bad was the pain before?
Well, it was it was kind of unbearable that last time.
Mm-hmm.
I just knew I had to do something
Yeah,
now.
yeah. No, your
And,
pain was up to 8, 9, 10, especially when you couldn't do really much because that pain would make you stop, right?
that's right.
5 years ago, you came to us. We noticed you have a scoliosis. But at that time, we noticed as well that most of the pressure was in certain area of your spine. At that time, we decided not to correct the scoliosis, but just go take the pressure off. The first surgery that we did. It was a microdiscectomy 5 years ago. Did it help you initially, that surgery? That's the first surgery that we did 5 years ago.
It's the first time I had
Yeah,
that surgery.
but then the pain came back and it was even worse, wasn't it?
That's right.
And no, and then once we went through all the diagnostic and so on, we noticed that you have a scoliosis in your entire spine. As a matter of fact, it goes all the way from your chest down to your sacrum. You had the scoliosis with significant bending of the spine. But then we noticed though most of your symptoms come from the bottom tree level. Even though your spine is all bad,
Yes.
we noticed that the bottom tree level are giving you most of your symptoms. And we talked about what to do. One in your age group, open old-fashioned surgery would be too demanding. And you asked me just a few minutes ago that why is it that some people go through multiple surgeries and still are miserable, but you just told me that your pain is completely gone. You remember that?
Mm-hmm.
So
That's right.
who have you told, or how do you know that lots of people go through lots of surgeries and still are painful? How do you know about that? Do you have friends that have gone through other kind of surgeries and are still in pain, or?
Yes, I'm thinking of a classmate of mine, and sometimes people ask, and I say, well, I can't speak for what your situation is, but I know what it did for me.
So how is your pain now?
I have none.
You have no pain. And even though we did not fix everything, and this is what I want to turn around and saw that you had thoracolumbar scoliosis, and we did a limited surgery for L3 to S1. We did a minimal invasive OLLIF, and we went and put the screws in and bent the spine correct way, only in bottom tree, even though you have other problem up here. But because your symptoms were corresponding to bottom tree level, we said instead of doing a big surgery and instead of doing an open old-fashioned surgery, we just did the surgery for bottom tree level, and you are proof that that is actually enough to give you improvement, meaning your pain is gone even though we didn't fix everything. That is something what we say, we are fixing your symptoms, we are not fixing the pictures on the computer. So, and even if you would have done a big surgery, meaning from your thoracic region to the lumbar spine, we still would do it minimal invasive with smaller incision and still would be way more gentler than doing old-fashioned surgery, slicing your back open, filleting your back. But even in this situation, we decided just do just a limited surgery, a segmental correction. Surgery was 9 months ago, and you're telling me your pain is gone. Is that correct?
That's right.
But only if you are in one position too long, you get some discomfort. So tell me about it. How does your daily activity look like now?
My daily activity?
Yeah.
Well,
what can you do? What can you not do?
I'm not doing my teaching anymore, which I did for 45 years.
How old are you?
I'll be 87.
It is time for you, just take care of yourself. You have done enough.
Mm-hmm.
You have taken care of. So you're 87, so you don't do the teaching. What else? How else does you?
So I live in the monastery, and it's like a family.
Yes.
And so there's always family chores, and I don't have any big responsibilities. I just do what I can to help in whatever way.
And so are you happy with the level of activity that you're having right now? And that it is what we try to do, we are not trying to make an 87-year-old person a 40-year-old person, but we are trying to make an 87-year-old person to be able to do what somebody in your age group is able to do and bring satisfaction to life, get the sharp pain, get the pain away. And and the walking, how is the walking?
With the walker, I'm fine. I don't walk as much as I used to, of course, but
Yeah.
I understand that.
Yeah.
And we have a large building and there's long halls, so I know walking is very good, and I try to do it some every day.
Good, good. Now, I think one of the most important question here is, are you independent? Can you take care of yourself all by yourself?
We have we have some LPNs around the clock, but I can do most things for myself. When I first came back from the villa, I needed a little more help.
Yeah,
But,
initially after the surgery, which is normal.
If it's something like flipping a mattress or something, I expect somebody is there to help
Oh
me.
yes, absolutely. Yeah,
Because
flipping the mattress. Those mattresses can be heavy.
Yeah, and I think, well, it's not worth getting back to the pain.
Absolutely,
I
absolutely.
don't
You're
have
right.
to do that.
No, you don't. You don't. But for most of your basic daily activity, you're okay.
Yes, I can, and I.
So overall, are you happy with the result of the surgery so far? Did the surgery did for you what you were expecting to do?
I'm happy with what happened. Yes. I
Yeah,
am.
excellent, excellent. Well, thank you really so much for the interview. I really appreciate that, and thank you again for all the good work you have been putting in your work as a nun and as a teaching and so on. Thank you very
Well,
much.
thank you for all your good work too.
Thank you very much. I appreciate it.